Paul's Place is about going above and beyond for the residents of Southwest Baltimore. They meet guests where they are and give them resources to move themselves forward. What better way to meet people where they are than seeking out folks in the community who could use a hand? Paul's calls this community outreach, and these outreach efforts are spearheaded by two unique individuals with complementary skill sets.
My name is Yale Partlow. I work for the University of Maryland Baltimore Police Department at the rank of corporal. My role here at Paul's Place is to primarily offer my resources, powers and discretions, and experience and know-how that I've gained over the years to assist Paul's Place providers.
My name is Damian Teep. I am the peer recovery advocate here at Paul's Place. I am also a person in long-term recovery from substance use disorder and mental health disorder. I have a lot of resources in the recovery field, treatment programs. I give one-on-one support. I do Narcan trainings. I go out to encampments, and I engage with those that we serve on a daily basis.
So what is community outreach, and why is the UMB Police Department dedicating resources to the expansion of its outreach unit?
Community outreach to me means essentially meeting people where they are, getting to know people, trying to determine what their needs are, and trying to understand the context in which they live. Taking part in the community rather than kind of approaching it as an outsider coming in trying to save the community. At the beginning of this outreach unit, we needed access to a wider range of service providers so that we could better refer people based upon their individual needs. And so Paul's Place has a lot of capabilities, case management, walk-in clinic, and a number of wide range of services that a lot of the folk, particularly our homeless population, could very much benefit from. What we're doing at UMB as an outreach unit and in partnership with Paul's Place. Although it's counterintuitive to think of police in this role as in an outreach role, this model, we call it a co-responder model, is proving to be highly effective and perhaps maybe the model going future nationally. This has very much to do with, rather than just assuming the role of law enforcement, is to actually make efforts to become a part of the communities that we're policing. To get to know people and to build relations in ways that weren't there before. Ultimately, this contributes very much to public safety in that we have greater cooperation from community members, and it's non-coercive cooperation. It's based on mutual respect and mutual aid. This thing is very much possible. We've been doing it for a number of years successfully, both as an independent unit and in partnership with other providers.
On outreach, we go into encampments. In these encampments, a lot of the people that are there, some of them might have had, circumstances that they ended up on the street. What we do is we provide resourcing for them and referrals to other treatment programs to if they need medical attention. And we just do the best to serve them where they are.
It's really dynamic in terms of what we run into when we go out, but having the peer recovery specialist there and having the clinical nurse there gives us a lot of capabilities that we as a department didn't have before. Being able to provide someone with medical assistance and medical attention that we wouldn't otherwise be trained to give. And also having the peer recovery specialist there in a unique role and being able to connect with some of the folk we engage with because the peers themselves were once in their position, and so that's been a really great resource to have in terms of helping to build connections between people.
Relationship building is incredibly important to the work I do. As a peer, a lot of people look at it as we help others, and really we support those that we serve. So it's nothing that I do, it's what they're willing to do. A lot of the people we serve are very caring, genuine people. It's just the disease of addiction keeps them stuck. And, I just try to do my best to share my experience with them and push them forward. The recovery process is non-linear. It doesn't start with I'm actively using and I go to treatment and I stop using drugs. It doesn't work that way. Like I say, until it hits home, you probably will never be open-minded to the idea of the recovery process. And I just, would wish that people would engage more to opening up, to finding out more about that,
there are a lot of assumptions that folk make, and I really just would like for them to kind of understand that things aren't always as they appear to be, or as they have been portrayed on television, on news, within the media. And so folk that live here, regardless of whether they're living under the poverty level, regardless of whether they're homeless, regardless of whether they're struggling with substance use or mental illnesses, that they are human beings. They are fundamentally people, and should be and can be engaged with, just as you would engage anyone else where you live.